Good afternoon. And today I have a pleasure interviewing Dr. Paramesh Gopi. He is a founder of Sound Health. And on today's episode, we're going to talk about topic so close to my heart, congestion, blocked nose. Because as a dentist who help people sleep and breathe in the same time, I noticed most of my sleep apnea patients have blocked nose. And I always said, we're going to address it holistically. You're going to use some irrigation, you're going to use some creams. But what happened? People use all of that, and they don't see any discharge, nose is still black, or it's on black for a little bit, then black back again. And what if nasal congestion connected to nervous system, inflammation, but also vibration and resonance can change that? And we're going to interview Dr. Paramesh Gopi today, who was one of the founders of this wearable device, but using acoustic resonance and AI technology to improve nasal breathing. But my patient can actually sleep and breathe at the same time. And as someone who works on intersection of sleep, breathing, and whole body health, I'm fascinated how this new technology changing the future of airway medicine. So if you or your loved one suffer from chronic congestion, nasal breathing and sleep, autonomic nervous system regulation, because I noticed what a lot of people who breathe through their mouth, they're also anxious in the same time, or passionate about sound therapy and inflammation, AI personalized for medicine, and future of airway care, you're gonna really enjoy this episode. Now, I want to introduce you my guest, Dr. Paramesh Gopi. He's not doctor like MD. He's actually doctor of physics. Very knowledgeable person who used his personal story, what he's going to share with us, to bring this invention to the market. Like a lot of people have great ideas, and I'm sure a lot of them you meet on my channel, but it's really science and art make the invention what get in the hands of people who need care. So please share with us, doctor, what was your life pathway, what you get to this?
Yeah, so thank you so much, Maria. I appreciate you taking the time, and it looks so nice on you. So a couple of things. I started off as patient zero for this device. I was after many rounds of antibiotics in 2019 before the pandemic. I could not bite for a whole month because my sinuses were very infected. I was actually sent in to see Dr. Peter Huang, who is the head of the Stanford Sinus Center, for surgery, for surgical correction to my sinonasal cavity and my sinuses, because I had intractable sinusitis, right? And I've been having allergies all my life. I'm the kind of guy that used to pop antibiotics when I went on a plane to Hong Kong, right? So that's how bad it was. So it got so bad. So I went to Stanford, and Dr. Huang looked at my CT scans and he said, "Well, I'm not going to operate on you." And I was very puzzled. I said, "Why is that?" And his response was, "There's nothing inherently wrong with your anatomy. And if I operate on you, you're going to come back and tell me I didn't fix you in 6 months, right?" So he then, as would only happen at Stanford and the Valley, I said, "Well, what do I do with this really bad chronic problem?" And he said, "Have you tried humming? Have you chanted? Have you tried doing things that are natural?" And I said, "Well, I don't know how they would work." So he told me to meet me after office hours, and he actually introduced me to Dr. Bryant Lin. So we wouldn't be here today without Dr. Lin and Dr. Huang, who are the actual medical and the surgical brains behind what we have today. So they then took my CT scans and they calculated all of the resonances in my skull. So as you know, your skull is a cavity. It's basically air-filled spaces are the sinuses. And so when they calculated those resonances and they gave me a bunch of buzzers and toothbrushes in the early days to start to stimulate the air and the mucus in the sinus cavities, within 2 days they said, "Stop all medicine, see how you feel." I was transformative. So I
Love
ended
this
up going,
approach.
yeah, so it was transformative for me. It's been 6 years. We have 10 studies, 2 FDA clearances, and I haven't taken a single nasal spray or antibiotics for any sinus infection in 6 years. So from now to we have 15,000 patients nationwide on this device. It's used across the country at leading academic institutions, so Harvard, MGH, UCSF, Stanford, and the fact that we have such good peer-reviewed data on the device, we have proven that it's equivalent to a steroid, if not better, right? So we have all of the data science, and the coolest part about it is, how do we bypass a CT scan? How do we get CT type data? Because every person has a different CT scan, right? So one of the big things we as computer scientists and physics people worked on is, can we take a picture or a scan of your face, and can we train exactly with your phone? Can we train machine learning algorithms to get to 90% of a cone beam? And we can. So now we've got the largest living craniofacial data set in the whole world as a company. And with your voice and your anatomy, we can very precisely target treatment for you via the band.
This is so amazing. I want to talk a little bit about technology. I'm going to tell you my fascination first. Of course, I'm number one, I'm very big fan of non-medication approach to treatment. I had a lot of great mind right here on this podcast when we talk about how we can replace medications with something else. Because as a doctor, I see two sides of medications, positive side and side effects. That's normal. And sometimes all the extent of the side effects we cannot see because they are on a microbiome level. Yes. So when I got this SONU Band and I read the instructions, which very well described in a brochure, and I, connect, I download the app, and I scan myself to, to start, the treatment session. I was really fascinated with the graphic and and the music, and it was all, for me, like a space type of technology. I called my team. I said, look, oh my God, like it was experience. It was really, futuristic, artsy experience. So, but can you share with my audience how exactly? Yes, I got it. We scan it. You have a wonderful, idea what's inside the cavity, but what actual mechanism? How come people just from wearing something, it doesn't hurt, it's no pain involved into this, but vibration involved, no heat. So how it works on a whole sinus intricate labyrinth?
No, great question. So let me start with the physics. There are two major pathways. One is the physical pathway. So as you all know, one of the big things that your sinuses do is they produce nitric oxide, because they are the chambers that contain tiny hairs called cilia and the mucosal layer. So when you're breathing air through your nose, the airflow across the sinus cavities and the ostia produce nitric oxide that regulates all of your immune functions in your body. This was a Nobel Prize that was granted in 1991 to a bunch of scientists here in California and in Europe. That's why the sinuses are so important to keep clear. But each sinus is a hollow physical cavity. I like to show this as an example to viewers. This is a classic Chinese vase that looks like one of my maxillary sinuses. So if you imagine this as a sinus cavity, which is sitting here, you have a volume. So this space and air inside this, and you have a neck. So all of you have blown through bottles, Coke bottles, vases. If you blow, you'll hear a sound. That sound, or those sounds, are the resonant cavities of this, resonant frequencies of this cavity. Okay, so as you know, resonance is very important. When you play a musical instrument, when you're hitting drums, resonance of a cavity is a function of its shape, and it's the frequency where the most energy gets exchanged between the air inside and the vibration outside. So if I can find the resonance of your sinuses, and if I play those sounds, if I vibrate your sinuses, because it's bone, bone has no loss, no conduction loss. It's instantly conductive. So when I vibrate or tap on this bone, all of my maxillary cavity gets stimulated with that vibration, which is why we made the SONU band sit here. This is the top of the sinonasal cavity. And for most people, you're a doctor, it is the thinnest part of the bone skin interface up here in the forehead.
True,
So
no fat.
yeah, so no fat. So basically, you're getting the entire vibration into your maxillary sinuses, at which point in time you're moving the air. So if you have things that are stuck inside, you start to move the air, and the little tiny hairs that sit here, which are constantly sweeping mucus, they're all stopped because of all of the mucus inside. You start to move the air and the mucus out of the sinus cavity. If something is blocking this, because of the vibration, you're able to dislodge it. So we're using very targeted vibrational frequencies which sound like music. And that was the funnest part for me. We sat down with the Stanford Orchestra and we actually engineered these strings and the drones, because you have to look at all of the frequencies of your maxillary sinuses, your ethmoidal sinuses, and your frontal sinuses as you wear the band. So we're sweeping through each set of frequencies to activate the air within the sinus and to sonicate the mucus. That's the first mechanism piece. The second mechanism piece is even more subtle and beautiful. Inside your nose are turbinates. The turbinates are structures that have erectile tissue that are surrounding them, that essentially, when you have inflammation, they flare up, right? There's edema. So what controls those are the nasal nerves that sit here and the sphenopalatine ganglion that sits behind your eyes. So when we resonate the sinonasal cavity, we resonate the nasal nerves and the sphenopalatine ganglion. And if you go look at the Nobel Prize in 2010, there was a Nobel Prize granted for people who found out that the neck and the face have the highest piezo meaning mechanical receptors for nerves in the whole human body, right? So when we resonate the nerves and we put energy into the sphenopalatine ganglion, you will see automatically that vasoconstriction happens. So the inflammation goes down in the turbinates and you open the airway. So that these two actions let the body heal itself. Once you breathe, you get more nitric oxide in. It's the equivalent of taking a natural antibiotic, because you're once again restoring the immune function of the nitric oxide and what it does for the lungs and what it does to keep the immunity fully up and running.
No, that this is, I'm listening to you. It seems so logical to me, but I understand to have it, to implement this, to put it into one piece of technology, which is very pleasant to have on, and you can do it before bed. Can we talk a little bit about a recommended regimen? How, another science and of course art, to incorporate something new in already very filled routine. So what's recommendation on this device, how people can make it part of everyday life?
Great. That's a fantastic question. So we've now run 10 studies. We have two FDA clearances, de novo for adults and for kids. We just got our kids clearance.
Oh, I
The
didn't
recommend
even know.
Yeah, so we have pediatric clearance now for this device. And so really, because these standards were gold standard placebo-controlled trials with an active placebo, so we had to play the frequencies that are outside your resonances. And all of this is published in very high impact journals. I'm happy to send you, or if you go to our
Yeah, we will
website, you can
include, I
read all the
suggest
articles.
we include
Yeah.
the reference underneath the interview for people to have scientific proof of this device. It's very important.
Correct. So the effect lasts about 4 to 6 hours based on all of our studies, and we wear the recommended dosage is 2 15-minute doses, morning and evening. So you can wear it. You can be walking your dog. You can be drinking your espresso, or you can be watching Netflix at night. It doesn't matter. So for me personally, and now we've got over 15,000 people on this device, and we have the largest usage data set. So what I wanted to show you was also the fact that if you look at it, if you look at the number of sessions that people have done on Sonu, we've got over 500,000 dosage sessions that have already been done. It's amazing, right? So really, it's a testimony to how much work and how much data science has gone through this. We have 500,000 treatments delivered. We have almost a 65% plus engagement rate on the app. So people, once they use it, if they open the app, and most people use it 3 to 4 times a week. You don't have to use it every day. But for me, if I don't use it for 3 days, I start to feel my nose getting congested and all of my autonomic response again being stimulated, right? So the recommended dose, twice a day, 15 minutes. Now most people use it 3 to 4 times a day, 5 minutes in the morning, 15 minutes at night. It's very pleasant to go to sleep with.
So you recommend people actually go to sleep with it and sleep with
So
it
before
well?
you go to sleep, so before you go to sleep, like I put it on and then I just remove it. And we did a study for CPAP patients
Yeah, that's
who were
interesting.
so we actually went to San Diego before we got FDA approval. We wanted to just run a study to look at people who were returning their CPAP machine to their doctors because they could not comply with insurance requirements for 75% usage time per week. And we gave them all a SONU Band. We looked at this. This is published in Sleep in 2024. Sleep. You can actually look at the. And we rescued 30% of them back into insurance compliance, and we improved everybody by 50% in terms of AHI, use, and mask sustenance, which is a huge deal because
Yes.
we were equivalent or better than a nasal spray for these people.
This is very fascinating information. I see people who struggle every day. Yes, I do oral appliance therapy for my patients, but I'm a firm believer what one therapy cannot be lifelong treatment, and sleep apnea is lifelong disease, and it's contributing to longevity and full body inflammation. Um, that's
So
another thing I want to add. I want to ask a question, but it's not a question. We both know. You mentioned about stimulating the nerve to create vasoconstriction. But what I noticed, and I have 100% correlation between anxious people and mouth breathers. So stimulation of parasympathetic nervous system with nasal breathing, what SONU Band actually help with, it's really create that relaxation effect and better nights and better productivity or happier state of mind through the whole day. So I think this is so fascinating.
I think, Maria, you touched on a really important point. We are now working with a set of psychiatrists in Chicago at the University of Chicago and with the Singapore government to really look at anxiety disorder and breathing, right? And we want to do it properly and rigorously, to your point. So because of the actual autonomic pathways that we have access to via the band and the nervous system, the trigeminal, the trigeminal nervous system, as well as the vagal complex that sits in the forehead, you're absolutely right. There's 100%. There's a very tight correlation between mouth breathers and anxiety, right? And I think if you talk to the psychiatrists, they want something that's better than a benzodiazepine or better than
Oh,
Klonopin or clonazepam, right? They want something that they can put on people that will naturally reorient them quickly to a state where they can breathe through their nose. And so there's a lot of experimentation going on now academically with our device. You're thinking very, very far ahead, where they're now looking at these types of devices to really deal with generalized anxiety disorder, right? And that's probably 2 years out in terms of getting all the FDA work and the trial work. But you're absolutely correct. Most people that wear the device feel relaxed. And by the way, we've also noticed in our first two studies a 40% reduction in craniofacial pain. So
Oh,
because
I
we are
agree
dealing
with
with the
you. I just met
with
somebody like that yesterday. You can breathe
yes,
without
so
pain if your mouth breather.
in fact, some of the orthodontists that are working with us give this to patients after they tighten their marpies or their braces because they say that it helps them relax and lets them basically, continue the treatment with minimal pain and keeping their mouth closed as they're breathing to create the space, right?
My last question to you. You mentioned something, but also, I want to bring to my audience. What's your next project in a sense of non-medication approach to personalized AI-based technology? Paramesh?
So we ran great question, and thank you for bringing that up. We ran a bunch of trials because we found that most people who wear this device in the nights, they just doze off 3 years ago. And so we actually thought about why is this promoting us? I mean, it's promoting relaxation, but when you doze off to sleep, it's promoting the first onset of a sleep cycle, sleep architecture. So we worked with Dr. Kushida, who heads up the Stanford Sleep Center, and Dr. Lin actually thought about a way to build a sleep device, which, by the way, we brought to market as a wellness device, and we will be running with Mayo Clinic and a few other people the largest trials today in the world for using ART for insomnia and in the future for sleep architecture changes. Because we know your cranial structure, we know your skeletal dimensions, and we have access to your supraorbital nerves, we have the ability to use neural entrainment, which is a big deal because your brain can tune to sound. As you probably know, most cultures have music as a very important way to move people to sleep. If you listen to a waltz, if you listen to Handel's water music, a lot of the arts and the ancient sciences have converged on how to make people sleep. People, rock babies back and forth. So you're entraining the neural autonomic system to really go to a relaxed state. That's our next big. So we built our first sleep band. It's called Spatial Sleep. And believe it or not, we built just a pilot build and we're completely out, right? So we're working with leading sleep clinics as well as we're running the first big RCT this year for our devices to get approved for insomnia. Different software, different resonances, because you're not dealing with the sinuses, you're dealing with the brain, the cranial resonance, right? So that's the next big work for us to get done this year.
I'm very proud. I really appreciate what you share your knowledge with our audience. And to finish our interview, I want to talk about ancient medicine. I just came from Greece, and
Oh.
I went to Greece to study what Hippocrates did. Founder of Western medicine. But even before the Hippocrates, according to legend, he was descent of Asclepius, we can say god of medicine. So
Mhm.
Asclepius had a sanatoriums, they call it sanatoriums, or we would say medical temples run by medical priests. And Asclepius' principles was when people come to his sanatorium for treatment, the main treatment strategy was sleep. But to put people to sleep, yes, he used purification with the water, but also he used arts, music and theater, which was right next to the sanatorium when he put his patients to sleep. The play performances was right, next door, let's say next space. So it was very important for that, you know, slowly putting to sleep, just like you mentioned with your next device. So I would say you're not inventing the new, you use ancient principles which were, let's say, 6,000 years. I don't really know if Asclepius was how many years ago we believe he was with the people or if he was actually existed, but his sanatoriums are real, it's existed, and they use theater and sleep as a method of treatment. And I saw it with my eyes in Greece. They exist all over the ancient Greece territory. So congratulations on bringing old principles to life.
It's very heartening for me to hear the story. I didn't realize that that's what they did. So it's
Yeah.
great learning for me. Thank you for bringing that up. That's so cool. That something that evolved from that is now in a small wearable today. So yeah, it's been a great pleasure, Maria, having this conversation. Thank you so much for having us here.